Thousands of women with early-stage breast cancer may be offered an innovative type of radiotherapy that can be carried out during surgery. The National Institute for Health and Care Excellence has published draft guidance saying the treatment could be more convenient for patients. Here's Sophie Hutchinson.
Every year, around 35,000 people are diagnosed with early-stage breast cancer. Many undergo surgery to remove tumours, followed by weeks of radiotherapy. But the new treatment the NHS looks set to offer involves a one-off dose of radiotherapy, carried out in the minutes after any tumours have been surgically removed. The treatment lasts 20 minutes and has the benefit of directly targeting the affected area without having to go through the skin. Trials over 10 years have shown it to be just as effective as conventional radiotherapy for particular groups of patients.
If you've just been diagnosed with breast cancer, you'll be worried, you'll be frightened. The last thing you'll want after surgery is to have to go back to hospital again and again for radiotherapy. It's disruptive, it's stressful, it's inconvenient. And now, it seems, it might not need to happen. We will hear exactly why that is in just a moment. But first, Sally Greenbrook from Breakthrough Breast Cancer says the news, if it's true, is great.
We're really pleased about this. We think this could make a real difference to patients. At the moment, patients who need radiotherapy are travelling to and from hospital every day, 5 days a week for 3 weeks. And that's hugely inconvenient. It's disruptive to their lives. It's disruptive to their families' lives. This means that patients can have radiotherapy in one dose during surgery. That means they can get on with the rest of their treatment much quicker. They can get on with their lives much quicker. So this is brilliant news from NICE.
Well, Professor Jeffrey Tobias is Professor of Cancer Medicine at UCL and lead radiation oncologist for the study of breast cancer, and is here. Good morning.
Good morning.
Let's start at the beginning then. At the moment, what is normally happening to a woman? She's been diagnosed, she has the surgery, she's got early stage breast cancer. What do you need to go back then to do?
Well, of course, these days more and more patients with breast cancer have relatively small tumours and are suitable for what we call breast conserving surgery, so they don't require mastectomy. But the traditional view over many decades now is that these patients should be treated extensively with post-operative external beam radiotherapy, which, as you just heard Sally say from Breakthrough, takes 3 weeks. Actually, it takes sometimes rather longer than that. That's a 5-day per week treatment. So there's a minimum of 15 sessions, plus, of course, at least one planning session a week or two beforehand. That's what is normally done. And what we have done, and we started this work at UCL in 1998, is to look at a very different alternative, which is to use a single shot, if you like, of what we call intraoperative radiotherapy. That's to say that under the same anaesthetic, which has to be slightly prolonged, the surgeon will remove the cancer, exposing the cavity, and while we have the patient asleep there and then, we put in the radiation probe. It takes about half an hour, and for the majority of patients for whom this treatment has been selected, the job is essentially done there and then. They wake up, they go home, and that's that.
And it works. You know it works.
We know it works. We published a very large paper in The Lancet earlier this year. It's over 3,400 patients from 33 expert treatment centres in 11 countries, and these patients were randomly allocated between the conventional treatment and what I've just described, and provided that the treatment with radiotherapy is given at the same time, immediately following the surgical resection of the cancer, there is no appreciable difference at all in the outcome results.
And
it's very
how
exciting.
widely available is it today?
Well, that's a very good question, because as is so often the case in the UK, we're pretty good at creativity and not very good at implementation. I'll tell you that in Germany there are 60 centres capable of doing this. We have about 6. So for us, this imprimatur from NICE this morning is fantastic news, because of course that will stimulate the uptake of something which actually started here.
You say stimulate the uptake. So NICE, the National Institute of Clinical Excellence, they are the people who can say, we think that this ought to be a treatment that is available. That's the case.
Yeah, broadly speaking, that is absolutely right. So, they don't necessarily pay for it, but it's hugely...
Well, that was going to be my question, because what difference actually does their statement today make?
It's enormously influential, and I think it's very difficult difficult for planning authorities, NHS England, trusts, etc., who want to remain in the Premier League to deny a means of finding the money to do this. Now,
but at the moment, just to get this absolutely straight, at the moment, in most places around, presumably we're talking about England and Wales, around England and Wales, it is not available.
It's not yet available. That's absolutely right, and we are sad about this. We're lagging behind. We're out of step. It's a great pity, but this news is really what we were waiting for. And of course, one of the things which is very important is that some 30% of the total volume of work in a typical radiotherapy department is devoted to breast cancer, because this is such a common diagnosis.
So
this one diagnosis, that's the point.
I mean, is that true, then?
It is absolutely true from the projections we've made. We expect to save a lot of money from the freeing up of resources of other equipment.
Just isn't an excuse, then, not to do it.
I take the same view, Justin, but others will think for themselves.
Professor Jeffrey Tobias, thank you very much for talking to us.